overwhelming at some point in life. You need somebody to talk to. We as mental health practitioners, and we are many psychiatrists, want to help. We are willing to help. Kindly come and see us. We want to help you.
Okay.
Yes.
You know, we've talked quite a bit about the stigma in Kenya and in Africa as well. But what is it like for a person watching us from a rural area right now? Because within the city, you know, I know that I can reach you or reach another psychiatrist should I have an issue. But what's it like in the rural areas, and what can be done to be able to allow those people to access care?
Okay, I have seen, or we are aware that within the rural context, then anybody who has a mentally ill relative, friend, or child locks them up or then wants to hide them from public view. It's because, again, I address the word stigma. Without the stigma, it will be a disease like any other. It could be like malaria, it could be like typhoid. So what needs to happen then is that the people, once the people are conditioned to realize that it is a disease like any other, then we will have everybody willingly seeking care, willingly seeking help. At the Mathare Teaching and Referral Hospital, where we have the most able team of psychiatrists, we have been trying to overcome that concept of stigma. But cordially, we need the public to know that you cannot stigmatize a condition, you can only treat it. You can only seek for a solution. Don't stigmatize. We have given access of healthcare to the people. Now we need to let them access it without feeling disenfranchised or stigmatized because of a condition that they have. Okay? So the people in the rural areas need to also come and talk to us. Yes, let's find somebody to talk to. Yes, we psychiatrists are here to help.
So, you know, there are different versions of what causes mental illness. Or is that able, are we able to pinpoint this is the reason why you're depressed or have anxiety or some other mental disorder? Are there causes behind it, or is it just something that occurs naturally? Okay.
Doctors' approach to disease is very methodical because it's a science. So we have a system of inquiry that is able to pinpoint the point at which there was impact on your life that caused you to be the way you are. So we follow a very systematic approach. It's called history taking. And when you take a patient's history, then it will lead you to the root cause of everything. It's like a mechanic working on a vehicle. There's a very systematic approach at how to arrive at a diagnosis. But everything gives itself away because then we are able to scientifically interrogate the circumstances in your life that get you to be who you are, and that's how we arrive at a diagnosis.
I am also aware that you are an advocate against gambling and the effects that has on one's, you know, mental capacity, etc. Maybe you can speak on that.
Okay, I am not an advocate against gambling.
Okay.
I am an advocate for responsible gambling.
Okay.
So gambling is something we call recreational risk-taking. That means it is a recreational activity, but anything taken in excess always then has a negative consequence. The Gambling Awareness Program is a hobby that I am doing on the side, where I seek to help them. It's a mental condition. Excessively indulging in the act of gambling then predisposes you to the negative consequences, because everything taken in excess has consequences on the individual. So we have seen cases of people committing suicide. There's marital distress because then a spouse could misuse the funds meant for other familial issues on this one recreational activity. It is not bad, but if you do it correctly, it is supposed to take away the pressures of normal living. It is a recreational activity. So the people who are actively engaging in gambling do not have an outlet when then it doesn't go in their favor. But we have a body called the Gambling Awareness Program, where we are assisting them to combat the negative effects of gambling. And we have a hotline, and we're in talks with the players involved to assist us help these people. So in as much as they are having fun in the process, then any negative consequence, we're also going to handle it. Okay? So gamble wisely. But in case you run into trouble, we are there to help. The Gambling Awareness Program is an entity that is going to assist the people handle the negative consequences associated with a very good activity. And I recommend that everybody needs an outlet for pressure. Well, it is pleasure seeking, but at the same time, it is also a way to let out distress. Okay? Let it not harm you. We are here to help.
So you've said that statement quite a bit, we're here to help, but let's talk about the expense of it all, because you know, seeking help for mental illness for some people is not a priority. You think, you know what, life is just tough, I'm going to tough it out, I'm going to do what I have to do, like you're saying, have a release, have an outlet. But in terms of expense, how does that factor into whether people are willing to seek help or not?
That is a tough one, because then the individual expense cannot then be related to the person. The Kenyan government has advanced the National Health Insurance Fund, which every citizen is being encouraged to enroll for, and then it is going to meet your healthcare expenses. So should you come then to the fore that you need to access mental health as a factor of life, use your NHIF card to access care at any government facility.
Okay.
Yeah.
Yeah, I think that's encouraging and necessary for people to hear. You know, do you have any last words on this? Because I'm sure that people watching who might want to, you know, get in touch with you, either come see you or have yourself go out and see them. So how can people get in touch with you if you know, they're thinking, I do need to reach out to someone?
Okay. Let me use lugha ya mwananchi. If we are trying to reach the people in the rural areas, we need to speak in their language. Ndugu zangu, kama uko na pressure kwa maisha, kuna watu wa kuongelesha. Hawa watu wanaitwa psychiatrist. Sio shida kuwa saa zingine maisha inakuzidi ama inakusumbua. Enda tu uongelesha mtu, na hiyo pressure ikitoka, unaweza enda uendelea kusurvive. Okay? So usikae ukijiumiza peke yako bila kuona ni kama kuna mtu anaweza kusaidia. Kujeni muongee na watu wanaitwa psychiatrist. Nataka inchi ijue kuna watu wanaitwa psychiatrist ambao kazi yao ni kusaidia. Hii mawazo ikikuweza, hiyo ndio kazi yetu, kukusaidia urudi kawaida na uendelee kuwa productive Kenyan.
And part of that treatment might involve medication as well as therapy, correct? Okay. All right. Thank you so much, Dr. Alfred Gitonga, for talking to us about the state of mental health in Kenya. I think, you know, we've talked quite a bit about stigma, and that's where it needs to start, with us destigmatizing this and, you know, going to seek help just like you would for any other disease. So thank you so much for being here on Power Breakfast. We've got much more coming up on the show. Professor will be joining us, and of course we do have another session with our chefs on the other side of the studio, so stay tuned.